Most people think they'll know when something is wrong with their heart. They imagine chest pain. They imagine clutching their arm, breaking into a cold sweat, the dramatic warning signs you see in movies. But here's what I've spent years trying to help people understand: the heart often sends its earliest distress signals somewhere. Most people never think to look, not in the chest, not in the arm, in the legs. And if you are over 70, or if you love someone who is, what I'm about to share with you could be the most important thing you watch this week, because these signals are quiet, they're easy to dismiss. They look like aging, they feel like tiredness, but underneath them, the biology is telling a completely different story. I'm Dr. William Lee. I'm a physician, scientist, and the author of Eat to Beat Disease. My work focuses on how the body's own natural defense systems, including the vascular system, the immune system, the body's regenerative pathways, either protect us or begin to fail us, and the heart and legs are more connected than most people realize. The relationship between them is one of the most underappreciated conversations happening inside your body every single day. Before we go further, if you're watching this on the Biosecrets channel and you haven't subscribed yet, I'd encourage you to do that now. The content on this channel is designed to give you real science-based health information, the kind that actually helps you make better decisions about your body. Hit that subscribe button and stay with me, because what I'm going to explain today could genuinely change the way you pay attention to your own health. Now, let me challenge something most people believe. When we talk about heart failure, and I want to use that term carefully because it doesn't mean the heart has stopped working, it means the heart is no longer working efficiently enough to meet the body's demands. Most people assume the first signs will come directly from the heart itself: irregular heartbeat, chest discomfort, shortness of breath, going upstairs. And yes, those things do happen, but the body is remarkably good at compensating. It masks the problem, it adjusts, it reroutes. And while it's doing all of that compensating, it's leaving clues elsewhere. Quiet clues, clues that show up in the legs, in the feet, in the way you walk, the way you sleep, the way your skin looks when you press a finger into it. The reason for this comes down to something fundamental about how your circulatory system works. Think of your heart as a pump at the center of a vast, incredibly complex network of pipes, your blood vessels. This network stretches over 60,000 miles if you laid it all out end to end. Its job is to deliver oxygen and nutrients to every tissue and organ in your body, and then collect carbon dioxide and metabolic waste, and bring it back for processing. When the heart is pumping well, this system works beautifully. Blood flows out through the arteries under good pressure, reaches the tiniest capillaries in your fingers and toes, and then returns through the veins. But here's the challenge. The legs are the farthest point from the heart. They are at the very end of the pipeline, and in the human body, what fails first at the edge of a system under strain is almost always the most distant point. When pressure drops, when flow slows, when the pump is working harder to do less, the legs feel it. First, they are, in a very real sense, the canary in the coal mine for cardiovascular health. And after the age of 70, there are several things happening simultaneously that make this even more important to understand. The heart muscle itself becomes slightly stiffer with age, a condition researchers call diastolic dysfunction, where the heart doesn't relax and fill as efficiently as it once did. The blood vessels lose some of their elasticity. The lymphatic system, which helps regulate fluid balance in the tissues, becomes less efficient, and the kidneys, which work in close partnership with the heart to regulate fluid and blood pressure, also begin to slow down. When all of these systems are working together under strain, the legs often become the first place to show it. So let's talk about the 3 signs, and I want you to really pay attention here, because each one tells a specific story about what's happening inside the body. The first sign is swelling in the legs, ankles, or feet, what doctors call edema. Now, I know what you're thinking. Swelling in the legs, that sounds familiar. Maybe you've noticed it at the end of a long day. Maybe you've been told it's just from standing too long, or flying, or eating too much salt, and sometimes that's true. But the kind of swelling I want you to watch for is different in a very specific way. When the heart is struggling to pump blood forward efficiently, blood begins to back up in the venous system, the return pipeline. Pressure builds in the veins, and when venous pressure rises high enough, fluid starts to leak out of the tiny blood vessels in your legs and pool in the surrounding tissue. This is called hydrostatic pressure, essentially the pressure of the backed up fluid pushing through the walls of the vessels and into the tissue spaces. The swelling that results from this process has a particular quality to it. It tends to be worse at the end of the day and better in the morning after you've been lying flat for several hours, because lying down allows gravity to assist the return of fluid. It tends to be on both legs, not just one, and here's the most telling detail. If you press your finger firmly into the swollen area, usually over the shin or ankle, and hold it for a few seconds, then release it, a small dent or pit remains in the skin. That's called pitting edema, and pitting edema in both legs, especially when it's persistent or progressive, is a classic signal of the heart struggling to manage its fluid load. Now, I want to be clear, not all leg swelling is from the heart. It can come from kidney problems, liver disease, certain medications, or venous insufficiency on its own. But what makes heart-related edema distinctive is that it tends to come with other symptoms: feeling more breathless than usual, waking up in the night to urinate more than you used to, or finding that you can't lie fully flat to sleep without feeling short of breath. These pieces together form a pattern, and patterns are what tell the real story. After age 70, this becomes particularly important because we tend to attribute these things to aging itself. We say, oh, my ankles always swell now, I'm just getting older. And while there's truth in the fact that fluid regulation becomes less efficient as we age, persistent bilateral pitting edema should never simply be accepted. As a normal part of getting old, it deserves attention. The second sign is something most people have never connected to the heart at all, and this one genuinely surprises people. It's cramping pain in the legs during walking that goes away when you rest. This is called intermittent claudication, and the biology behind it is deeply connected to the health of your arteries. Here's what's happening. As atherosclerosis, the buildup of fatty deposits inside artery walls, progresses, the arteries that supply blood to the legs become narrower. The medical term for this is peripheral artery disease, or PAD. Now at rest, the blood flow through these narrowed arteries may be just barely sufficient to meet the leg muscles' basic needs, but the moment you start walking, those muscles demand more oxygen-rich blood. They're working harder, they're burning fuel, and the narrowed arteries simply cannot deliver the flow they need. What happens next is a process called ischemia, a local oxygen deficit in the muscle tissue. The muscles, starved for oxygen, begin producing lactic acid and other metabolic byproducts, and this triggers pain, a deep cramping, aching, or sometimes burning sensation, usually in the calf, but it can also occur in the thigh or buttocks, depending on where the arterial blockage is located. When you stop walking and rest, oxygen demand drops, the imbalance resolves, and the pain fades, usually within a few minutes. This pattern is what makes claudication recognizable. It's not random pain, it's predictable. It comes with exertion, reliably, and it relieves with rest, reliably. Patients often describe it as their legs running out of gas at a certain point during a walk, and that description is actually quite accurate biologically. Why does this matter so deeply for heart health specifically? Because peripheral artery disease and coronary artery disease, the narrowing of the arteries that supply the heart, share the same underlying biology. They are both driven by the same process of atherosclerosis, the same inflammation, the same oxidative stress damaging vessel walls, the same cholesterol buildup. So if the arteries in your legs are significantly narrowed, the scientific evidence strongly suggests that arteries elsewhere, including those feeding the heart, are likely facing similar challenges. Research published in major cardiovascular journals has consistently shown that people with peripheral artery disease have a dramatically elevated risk of heart attack and stroke. In fact, some studies have found that the risk can be as high as 3 to 4 times greater than in people without PAD. The legs aren't just showing you their own problem, they're showing you a systemic warning about the state of your arteries throughout your entire body. And here's what makes this sign so dangerous after 70 specifically. Many older adults assume that leg pain during walking is just arthritis or muscle weakness or simply being out of shape. They slow down their activity, they stop walking as far, and because they're not pushing the arteries hard enough to trigger the pain anymore, they stop noticing the symptom, but the underlying disease continues to progress silently. This is one of the most common ways peripheral artery disease goes undetected and untreated in older populations. There's a simple bedside test called the ankle brachial index, where the blood pressure in the ankle is compared to the blood pressure in the arm, that can detect PAD quite accurately. If you've been experiencing this kind of exertional leg cramping and it relieves with rest, this is something worth discussing with your physician promptly. The third sign is more subtle, and in many ways it's the one I find most fascinating from a biological standpoint, because it speaks to something happening at the microscopic level inside your blood vessels. It's a change in the skin and temperature of the feet and lower legs, specifically skin that looks shiny, thin, or hairless. On the lower legs, feet that feel persistently cold, even in warm conditions, or a noticeable color change: skin that turns pale when elevated and then becomes a dark red or purplish color when the foot is lowered, a phenomenon called dependent rubor. Let me explain what each of these signals means and why they matter. Hair follicles in the skin need a steady blood supply to survive and function. When blood flow to the lower legs becomes chronically reduced, whether from arterial disease or from the heart not generating sufficient forward pressure, the hair follicles are among the first small structures to suffer. They're not essential for survival, so the body deprioritizes them. Over time, the hair simply stops growing in those areas, and the skin becomes smooth and bare in a way that's different from normal aging. The thinning and shininess of the skin comes from a similar process. The tiny capillaries that nourish the skin's deeper layers become inadequately perfused. The skin loses its normal cell renewal capacity. It becomes fragile, thin, and takes on an almost waxy or tight appearance. In severe cases, this can progress to wounds that are extremely slow to heal. Even small cuts or blisters on the feet can become serious problems when the blood supply is compromised. The persistent coldness of the feet is perhaps the most intuitive sign. Blood carries heat. When blood flow is reduced to the extremities, they become cold. It's not complicated, but it's easy to dismiss. Many people simply wear thicker socks or keep a blanket over their feet and never ask why their feet are cold in the first place. Dependent rubor is the most telling sign of all. When you raise the leg above heart level, say by lifting it while lying down, the foot turns pale or white because gravity is now working against the already compromised arterial pressure and the blood drains out. When you lower it again, blood rushes into the dilated capillaries, and the foot turns a deep red or violet color. This color change demonstrates that the capillaries in the foot have lost their normal tone. They're maximally dilated in a desperate attempt to capture whatever blood flow is available to them. It's the tissue at the edge of the system screaming for perfusion. Together, these three skin and temperature changes paint a picture of chronic poor perfusion to the lower extremities, which is directly tied to either arterial disease, reduced cardiac output, or both. After 70, these changes can easily be dismissed as just old skin or poor circulation. That's normal at my age, but I want to challenge that dismissal. Poor circulation is not simply an inevitability of aging, it is a condition with identifiable causes and meaningful interventions. Now let's talk about what you can actually do, because knowing these signs is important, but what matters most is what happens after you recognize them. The first thing I want to say clearly and without equivocation is this. If you are experiencing persistent bilateral leg swelling or reproducible pain in your legs during walking that relieves with rest, or the skin and temperature changes I just described, please see your physician. These signs warrant a proper evaluation. The ankle brachial index test I mentioned is non-invasive and inexpensive. Echocardiography can assess how well the heart is pumping. A physical exam and basic blood work can reveal a great deal. Early detection and intervention in both heart failure and peripheral artery disease genuinely saves lives and preserves quality of life. Don't wait, don't dismiss it. But beyond medical evaluation, there is a great deal that the biology of your body responds to, and this is where I want to shift from concern to possibility. Because the cardiovascular system, even in its 70s and 80 seconds, retains a remarkable capacity to respond to the right inputs. One of the most powerful things you can do for vascular health is exercise, specifically walking. I know that sounds almost too simple, but the evidence behind it is extraordinary. In people with peripheral artery disease, a structured walking program, what researchers call supervised exercise therapy, has been shown to improve walking distance, reduce claudication symptoms, and stimulate the growth of new small blood vessels, a process called angiogenesis. Your body can actually build new pathways around blockages when given the right stimulus. Walking to mild discomfort and then resting and repeating under medical guidance triggers this adaptive response in the vascular tissue. For the heart specifically, moderate aerobic exercise supports what's called cardiac remodeling, the heart's ability to adapt and improve its function in response to the demands placed on it. The key word is moderate. After 70, this isn't about running marathons. It's about consistent, appropriately paced movement that keeps the cardiovascular system engaged. Even 3 to 5 sessions per week of 20 to 30 minutes of brisk walking has been shown to produce meaningful improvements in cardiac function and vascular health markers in older adults. Food is another profound lever. The endothelium, the single-cell thick lining of every blood vessel in your body, is one of the most metabolically active tissues you have. It produces nitric oxide, a molecule that causes blood vessels to relax and widen, improving flow and reducing the pressure the heart has to work against. The production of nitric oxide is supported by specific dietary compounds. Dark leafy greens like arugula, spinach, and beets are rich in dietary nitrates that the body converts through a fascinating chain of chemistry involving bacteria in your saliva, of all things, into nitric oxide. This is one of the reasons that diets rich in vegetables are so consistently associated with better cardiovascular outcomes in long-term population studies. Omega-3 fatty acids found in fatty fish like salmon, mackerel, and sardines reduce the inflammatory processes that drive atherosclerosis. They help lower triglycerides, reduce platelet stickiness that contributes to clot formation, and support the flexibility of red blood cells so they can more easily pass through narrow vessels. 2 to 3 servings of fatty fish per week is a practical, evidence-supported target. Polyphenols, the compounds found in berries, dark chocolate, green tea, olive oil, and many other plant foods have been shown in clinical research to improve endothelial function, reduce oxidative stress in blood vessel walls, and support healthy blood pressure. These aren't supplements. These are real foods with genuine biological effects on the vascular system, and they work cumulatively, meaning the more consistently you include them, the more your vascular biology responds. Salt is worth addressing specifically in the context of leg swelling and heart failure. Sodium causes the body to retain fluid, which increases the volume load the heart has to pump. When the heart is already struggling, excess sodium makes its job significantly harder, reducing processed foods, which are the primary source of sodium. In the modern diet, and moving toward whole foods prepared at home gives you direct control over this input. You don't need to eliminate salt entirely, but being mindful of hidden sodium in packaged foods, restaurant meals, and processed meats can make a meaningful difference in how much fluid your body holds. Sleep deserves a mention here too, because it's underappreciated in its connection to cardiovascular health. During deep sleep, the body enters a state of reduced metabolic demand that gives the heart a genuine period of lower workload. Sleep is also when the brain clears metabolic waste and when stress hormones like cortisol and adrenaline are at their lowest. Chronic poor sleep, which becomes more common with age due to changes in sleep architecture, is associated with higher blood pressure, increased cardiovascular risk, and worsening fluid regulation. If you're waking frequently at night, particularly if you're also waking to urinate more than once or twice, this pattern is worth discussing with your physician, as it can be related to the nighttime redistribution of fluid in heart failure. I also want to say something about the emotional dimension of all of this, because health at 70 and beyond involves not just the biology but the way we think about and respond to our bodies. Many of the people I've spoken with over the years who have missed these early signs did so not because they couldn't see them, but because they were afraid to see them. There's a very human tendency to avoid information that feels threatening, to tell yourself it's nothing, to not want to worry family members, to feel that at a certain age there's not much point in seeking treatment anyway. I want to address that directly. The science does not support that perspective. Interventions for heart failure and peripheral artery disease, whether lifestyle-based, medication-based, or procedural, are effective across all age groups, including people in their 70s, 80 seconds, and beyond. Quality of life can be meaningfully improved. Symptoms can be reduced. Disease progression can be slowed. And more importantly, the feeling of agency of knowing what is happening in your body and taking intentional steps in response to it is itself a form of well-being. Your body is not simply declining, it is communicating. The swelling in the legs, the pain during walking, the changes in skin and temperature, these are signals, not death sentences. They are information, and information, when responded to correctly and in partnership with good medical care, becomes an opportunity. I want you to think about what I've shared here not as a reason for alarm, but as a reason for attention. Attention to your own body, attention to the bodies of the people you love who are aging. There is something genuinely powerful about knowing what to look for. It transforms you from a passive observer of your own health into an active participant. If you are over 70 and you've noticed any of these 3 signs: consistent leg or ankle swelling, leg pain that comes with walking and clears with rest, or changes in the skin and temperature of your lower legs and feet, please bring this to your doctor's attention at your next visit, or make an appointment specifically for it. If the symptoms are significant, write down exactly what you're experiencing, when it started, what makes it better or worse. Your physician will be better equipped to help you when you come prepared with that kind of observation. And if you are someone who doesn't have these symptoms, I still want you to take something important away from this conversation. The biology I've described today, the endothelium, the nitric oxide system, the arterial wall, the heart's pumping efficiency, all of it is responsive to how you live, the food you eat, how much you move, how well you sleep, how effectively you manage chronic stress. These are not abstract wellness concepts. They are real levers with real biological effects on the cardiovascular system. And the earlier and more consistently you pull them, the stronger the foundation you build for the decades ahead. I want to ask you something before we finish. Think about an older adult in your life, a parent, a grandparent, a neighbor, a close friend. Have you noticed anything in their legs lately? Have they mentioned their ankles swelling at the end of the day? Do they walk more slowly than they used to, stopping to rest more frequently? Have you seen them rubbing their calves after a walk? These signs, if present, deserve attention, and sometimes the people we love need someone else to notice on their behalf. Leave a comment below and tell me which of these three signs surprised you the most. Was it the leg swelling, the claudication, or the skin changes? I'm genuinely curious about what resonated with you, and I read the comments on this channel because the conversation that happens here matters. If this video gave you something useful, a new way of seeing your own health, or a concern clarified, or simply better information than you had before, please share it. Send it to someone who's over 70 or to someone who loves a person over 70. This is the kind of information that spreads in the right direction when people who care about each other pass it along. You might not know it, but sharing this could genuinely prompt someone to seek medical attention they've been putting off. And if you're not yet subscribed to BioSecrets, this is the place for exactly this kind of content. Science-based, human-centered, evidence-grounded health information designed to actually help you live better and understand your body more deeply. Subscribe and stay with us. The legs know things the heart hasn't told you yet. Pay attention to them. Your body is always speaking. The goal is to learn its language before it has to raise its voice.